My parents brought me up with the belief that your job in the world is to make this world better, and medicine fulfilled that role.
I wasn't expecting to get into medicine. That was one thing. I don't know how I got in, but I was very, very grateful. When I was in first year university, I met my future father-in-law, who was a family physician, and that sort of opened my eyes, and I thought, wow, that would be a wonderful thing to be able to do with my life.
In terms of what drew me to medicine, my late father was a pediatrician, and my mother trained as a nurse. My first job was at Royal Jubilee Hospital as a janitor in the operating rooms.
It's hard for me to tell you, over 50 years ago, what I was thinking at the time when I chose med school. I didn't go in saying I want to be a doctor. We started seeing patients in the middle of second year. That is really the great joy, being able to see people in all aspects, from moments of joy to tragedies, and being with them and helping them. And medicine gave me the chance to be that person.
Realize that the people that are here right now are wonderful people, and to be so grateful for the fact that they are here, because multi-generational care provided me with so much satisfaction and appreciation how fortunate I was to be able to do that.
For 42 years continuously, I was on a committee or some other work with BCMA and Doctors of BC, and that was always a pleasure and a privilege. The 27 years that I worked with Council of Health Promotion in various roles was probably the highlight of that, but I enjoyed many different roles.
If somebody has some good memories, is that I tried to repair the system by which we remunerate and understand how general practice family medicine is paid and how it's viewed in this province. If I'm going to be remembered, then hopefully it'll be for some of the payment models that we've created over the years.
I was given opportunities to build community, and that to me is so important. The Doctors of BC came by and said, Ken, how'd you like to start something called the Division of Family Practice in Maple Ridge? It was an organization that brought people together to share common goals, to support each other, and to maintain those relationships. You know, we don't do it on our own. For me to accept the award really isn't for me, it's for all those people that were part of it.
Well, it is truly an honor, and it's a reminder of the gratitude I need to have for all of the people that made that possible. I would thank my parents, all of my family members. I would thank the patients I had the privilege to serve, and the wonderful clinicians who taught me through medical school.
First of all, I was thrilled, honored, and kind of shocked. I thank those who considered me, and I thank those who honored me. I'll celebrate it with my wife and my kids and my grandkids, but the most important person is my wife, who gave me the opportunity to do what I wanted to do. The great joy is being able to come and spend time with my patients, and that's the way I'll celebrate it, by just doing what I love to do.
Being a family doctor allows you to have that longitudinal relationship. That longitudinal relationship with the patients is what really gives you the depth to understand the person and for them to understand you, and it gives you so much satisfaction. You know, if at the end of your career you can look back and recognize and remember all those patients you made a difference to, you're a very blessed person. I couldn't thank my wife enough. Jillian has been supportive the whole way through, and my staff, we have a family. We come to work every day. We spend a lot of time together, and we care for each other. We support each other.
I'm looking forward to perhaps working more on what the impact is of first childhood experiences, and also the Truth and Reconciliation Commission and the efforts that are underway to finally act instead of talk about what changes should be made.
In the thinking what I will do when I retire. To say that is to say that medicine is a career, and it's not a career, it's a calling. I like to say I'm a healer, I'm a physician, and I'm not going to retire from being who I am. So as long as these legs work and my brain works, I'll keep working.
I'm going to look for opportunities every day to be able to give back. I have a real place in my heart that I want to work with homeless. I feel very fortunate, and so I want to share that.
I would just like to commend all of the doctors for their devotion to this profession and their patients, especially during COVID-19.
Understand that whenever there's a crisis, there's a chance for repair. Then keep repairing it. Keep repairing medicine.